Hello, Kingston. Yesterday, Provincial Public Health officials shared some encouraging news. They believe that Ontario has now reached the peak of the current wave of COVID infections several weeks earlier than expected. Now, we're going to have to remain diligent with physical distancing for quite some time, but we can also begin now to plan how to move forward. My view is that reopening our economy and our community must happen carefully, in stages, and at the direction of our local public health experts. At tonight's City Council meeting, we will be discussing a motion that would ask the province for some local flexibility when it comes time to lift certain COVID-19 restrictions. Now, from what I've heard and read, there's been a lot of misinformation about what this motion is actually about, or that Kingston is somehow asking for these restrictions to all be lifted now. But the question before us is not when to lift these restrictions, but it's about how to plan to do it locally. The Premier has referenced that different regions of the province are in a different position when it comes to COVID cases. Dr. Moore, our Chief Medical Officer of Health for KFL&A, has voiced support for some degree of local autonomy so that we can respond quickly to changes in the spread of COVID-19 here in Kingston. So what do you think? Should our community have a say in how we move forward, or should decision-making remain at the provincial level? Reply to or comment on this post and let me know your thoughts in advance of tonight's council meeting.